So I've been working in global public health, or specifically global environmental health, since around the year 2000, so like 25 years. And over the last 12, 15 years, I've been working in Ecuador primarily. That's where a lot of my funding has been. And I started off focusing on enteric diseases, so these diseases that cause diarrhea in children, who are a really vulnerable population to that health outcome. And then more recently, I've switched into looking at the spread of antibiotic resistance in the community and how antibiotic resistance in the community then affects health outcomes when people come into the clinical setting with a multi-drug resistant infection and how you deal with that. So we also do a lot of work in an area called One Health, which is where the environment and humans and animals intersect. And so that's really important for antibiotic resistance, because there is antibiotic resistance in animals that gets shared with humans through the food supply, through the environment. So we've been doing a lot of research in this area. So I've worked with in a number of different studies targeting different populations, but most of my work has been in Ecuador over the last 12, 15 years. And we primarily work with sort of semi-rural communities. So they're almost agricultural communities. They usually raise some animals around their homes. And so we've been working there to understand diarrheal diseases, so these diseases that really affect young children who are vulnerable. And then we've also been looking at other zoonotic infectious diseases. And that includes things like antibiotic resistance, and we've been looking at zoonotic urinary tract infections in our latest study. Yeah, so we have this study. It's funded by the National Institutes of Health. And we're looking at zoonotic infectious diseases that are associated with poultry. And so we're looking at both live chickens in the household compound, and we're also looking at poultry products and understanding whether the bacteria that are on those products that are in the live chickens are affecting infectious diseases in humans. My primary advice to students considering a career in environmental health sciences is for them to talk to as many people as they can. So if you think this is what you want to do, talk to people that are doing jobs that you think you might want to have one day. And by talking to all those people, you can, sort of lower the bar to get a conversation going with them by saying, I just want to talk to you 15 minutes over Zoom, or I'll treat you to coffee even. And typically they won't let you treat them to coffee. They'll probably treat you, but by having these conversations, you can really understand a broader set of opportunities that might be in the career path that you're considering, and try to understand what are the stories of how they got to where they are. So what was their career path? What did they do? And you can usually learn something in those conversations and really better understand, is this something that I want to pursue?